Hello friends, welcome back one more time on my YouTube channel. Today's topic is one commonest topic, bleeding from the nose. Smaller children, they have 1 or 2 drops of the blood. When they wake up in the morning, you will see in the bed sheet there are drops of the blood. The bleeding from the nose. What are the reasons for that one? What you can do at home? When you have to go to the hospital? That all we are going to discuss in this video. Watch this video till end. It will give you useful information. Thank you very much. Bleeding from the nose. Commonly, we doctors tell him as an epistaxis. Epistaxis means 1 or 2 drops of the blood comes from the nose. Many times in the children, when you are seeing, they have blood from the nose. Sometimes in the school, there is a bleeding from the nose. When they wake up from the bed, there is a drops of the blood. You will see that bed sheets are covered with the blood. It causes a panic to the parents. Whenever the parents see the blood, it's panic. Then why this is happening? What are the commonest cause for that one? First of all, we'll discuss what are the age group which are affected. The bleeding from the nose or the epistaxis is common in the younger age group. Less than 5 years of the age group, it is very common. Generally, there is a seasonal preferences. In the winter, it is very common because of the dry air. Trauma is one of the commonest reason of the bleeding from the nose. How the children does the trauma? You know, when you are also young, you must be putting the finger into the nose. Sometimes the pencils in the nose, pen in the nose, and sometimes the erasers in the nose, and they will rub it. Once they will start rubbing it, the smaller blood vessels which are there in the nose will get ruptured, and that's why the bleeding come from the nose. Throughout the nose, the bleed can come from the any sides of the nose, but the commonest area is the nasal septum. This area, which is inside one, this one is the nasal septum. The nasal septum has a lot of blood vessels. It is a bunch of the blood vessels. Specifically in the front area, the commonest area which is known as the little's area. This little's area which is present in the nasal septum is very rich into the blood vessels. So whenever children pick that area, some drop of the blood will come. Generally, this bleeding stops by its own. No need to get worried about. Generally, within a few minutes, it will stop. But what you have to do at home if there is a more bleeding or there is a continuous bleeding? As I discussed, the nasal septum is the commonest cause from where the bleeding happens. So what you have to do? Do like this, pinch the nose. You have to pinch the nose and apply the pressure over that area for around 5 to 7 minutes. And now you will wonder that if you will pinch the nose and how you will breathe. So pinch the nose of the child and ask him to breathe from the mouth. You can continue this maneuver like the pinching the nose and the opening the mouth for around 5 to 7 minutes. And most of the time in the 5 to 7 minutes this bleeding stops. But suppose you have pinched the nose, bleeding stops, but still there is a trickling of the blood. Some or other blood keeps on coming. Then it is indication that you have to meet the doctor. Commonly in the seasons like the winter, it happens frequently because the dry air. When there is a dry air, it will irritate the nasal mucosa and the children generally rubs it. When they will rub, then the bleeding happens. So as I discussed, the trauma is the commonest cause when the children do the pricking. Dry air season is the commonest cause of the nasal bleeding. Some uncommon causes like sometimes there is some growth inside the nose which commonly we'll tell as a polyps. Small polyps like a small acne kind of the things develop inside the nose. And that is also one of the cause of the bleeding from the nose. And sometimes certain type of the bleeding disorders, like when in the blood we have the one cells which is known as platelets. If there is a deficiency of the platelet or there are low number of the platelet, then this kind of the bleeding happens. So these are the common causes of the bleeding from the nose. I told you when it is common, like the younger age group it is common, and I told you what you can do at home. So I hope this information will clear out a lot of doubts related with the nasal bleeding. If there is excessive bleeding or the continuous bleeding because of some severe trauma, like the child has hit over the wall or some child has hit him and there's a bleeding, then definitely you need to go to the hospital, because we have to see that how deep is the wound and how major is the wound and how much bleeding can happen. Suppose if bleeding is continuous, then the doctor will do some procedure which is known as cautery. Cautery means they will find out the source from where the blood is coming and they will burn that area with the cautery. There can be different type of the cauteries, but for you this is enough that they will burn that area with the cautery so that bleeding will stop. But there are illnesses where you have the bleeding disorders, like there is a low platelet or the hemophilia, then there are certain specific treatments required which your doctor can guide you. So I hope this information is useful to you. If you like this video, press the like button, share with your friends. I'm continuously preparing informative videos for you, and most of the topics I'm trying to cover it. So share with your friends, so it will be helpful for the parents to know all these things. And if you are first time on my YouTube channel, then subscribe as well. Keep notification on, because then you will get the update about my new video. Thank you very much.